Welcome. I'm glad you're all joining us. We're going to take a couple of minutes to wait for everyone to log in because I know that unlike me, not everyone goes off of military time and starts exactly on time, but also to be respectful for the people who are here on time. We're not going to wait a very long time. We're just going to give people about a minute and then we're going to jump right into it. But I'm very, very grateful, glad that you're here joining us today. It means a lot. It's important to talk about vaccines and building trust. So let's get started. Thank you again for joining us today for this Facebook Live episode of talking about earning your trust with vaccines. It's a difficult topic, not only with the new COVID vaccine, but with all the vaccines that exist. It may not be easy to trust people who offer the vaccines. I know I'm fighting for your attention. I know most of you are probably trying to do more than one thing at a time. You're juggling other responsibilities. So it's my goal to make this time together worthwhile for you. I am treating this as one of the hundreds, thousands of conversations I've had with patients and families about vaccine, giving you a chance to hear my perspective of how I help families understand better why we do vaccines and why they're so important. So again, thank you for your time. Who am I? Why am I doing this? My name is Dr. Jeff Hutchinson. I am an adolescent medicine physician here at People's Community Clinic. I've been taking care of 11 to 25-year-olds for many years, and I'm used to parents and patients asking about the importance of vaccines and why we do them. I'm also a retired Army doctor. I spent 25 years in the Army, including a tour in Iraq. So my experience is not typical, but I will share today what I've learned and what I tell people when we talk about vaccines. The most important is that I know we have to earn your trust. We have to get you to understand that we want what you want, what's best for your health. We want to be able to say that your health is as important to us as it is to you. Now, I know that I have privilege and I have lack of privilege. Some of my privilege includes being a doctor. Wearing a white coat opens up parts of hospitals and clinics that are not accessible to other people. It opens up people's lives so they can tell me about things that they just wouldn't tell a stranger. But I also lack privilege. As a Black man, it doesn't pass by me knowing that sometimes people won't believe things that I tell them until I show the receipts, until I give them enough evidence that I'm worth believing. As an Army officer, I was privileged to be able to tell people what to do, to give an order, and that could be done without question. So I understand the privileges. But the bottom line, my past, my clothes, my reputation doesn't mean anything unless you believe that I care about you. I also know that actions speak so much louder than words. So I have a video. The video is of me getting the Pfizer COVID-19 vaccine. And I want to show you that now, both doses. So I received the first one December 21st. I was very excited to get it. Like many people, the vaccine represented not only freedom, but an opportunity to protect myself and my family from the COVID-19. So I happily received it. People ask about side effects. It didn't hurt going in, but my arm was sore for a few days afterwards. But it's like many other vaccines. It was no big deal. I was fortunate enough to receive the second vaccine just last Sunday. The second vaccine, I'll have to admit to you that I was a little worried about it because I heard a lot of rumors about people needing to take off of work, about people feeling sick, about people not wanting to go through the side effects. So I received it January 10th. Side effects were my arm was sore again. I did feel a little viral. I felt like my immune system was doing what it was supposed to do, but that was it. Would I do it again? Absolutely. I show the video to show that most common question is asked of me about vaccines, any vaccines, is would I get it or would I give my family it? And the answer is any vaccine that I recommend, 100% yes. I do not recommend any vaccine that I would not give to myself or to my family. Am I worried? Do I worry? Of course, I'm human. But we'll talk more about that a little bit later. The next thing that I understand is that actions may not be enough to convince you. Again, I told you I'm an Army officer. I've jumped out of planes. If I told you that I jumped out of a plane, that may not be enough to get you to jump out of a plane. I understand that what I've done, what I've said is not always enough to get someone else to do the same thing. Because you don't know me. You don't know what I'm willing to risk. You don't know my health history. And I hear that reasoning all the time. Families know that they're individuals. They know that what they've gone through is unique. And they may not care that I'm willing to do it if I don't understand what they've been through. So the easiest way that we believe and trust the people who recommend things is when we identify with them. Black people I can identify with more. So I can give recommendations, and it's very likely that they'll believe me a little bit more if they are also Black. So what does that mean? If I'm dealing with someone who's a different culture, speaks a different language, who doesn't look like me, I have to work harder to get people to understand why I think vaccines are important and why they can trust me. That ability to gain trust is something that, again, as a Black person, I'm used to earning. I'm used to not assuming that people will automatically trust me. So that's something that is inherent to what I do. There is a fantastic doctor, Dr. Camera Jones. She is the master of metaphors. And with her inspiration, I have two metaphors that I want to use to help people understand better how we can build trust, how we can help you understand that vaccines are important and something that we want for your good health. The first one is about food when you go to a picnic or to a potluck. And the second one is about a suspension bridge when you cross it. So let me start with the food. Say you show up at a picnic or potluck. There's pies, potato salad. There's all sorts of food out on the table. How do you know what to eat? Well, you might watch and see what disappears and realize that might be good. But what most of us do is we're waiting for someone that we trust, someone who we know, to tell us, this is what you really should try. When our favorite aunt made the pie, we want that piece of pie. Because there's a saying among Black people, especially from the South, you don't eat everybody's food. And that is one way to look at how people who hesitate when it comes to vaccines approach them. At the very least, you might not like the food. At the worst, you might actually get sick off of something somebody else made. So it is our human nature to want to find out what's the good food, what other people have eaten, what other people have tried. That's what we want to try. How do you build that trust? That trust comes with time, with a relationship, and with experience. If you tried someone's food and it was nasty, you got the experience, you're not going to try it again. If you know your sister or your cousin has the same taste that you have, you've lived with them all that time, they've given you good advice in the past, you are more likely to believe their recommendations when they tell you that it's worth trying. The exact opposite is true also. When a family member said they got the flu vaccine and they felt sick, you are more likely to believe them that the vaccine might make them sick, as opposed to me, who you don't know, telling you that, yes, your immune system may respond. You may not feel normal, but it doesn't give you the flu. So that's the one analogy, talking to you about what food, and that's low risk, right? You're not going to starve. You're able to do a vaccine, and some people look at vaccines as not that high a risk. Let me look at the other analogy, crossing a suspension bridge. Here's an image of going across a bridge, a suspension bridge. Some people who are afraid of heights, some people who do not like the idea of crossing that, it's a very different conversation about whether they should cross that bridge or not. We as providers have to realize that there can be a strong emotional component to not wanting to get a vaccine. And while we want to believe if I just give you one fact, one piece of information that tells you what you need to hear, then you're going to cross that bridge. Where do we fall down? We try to explain that the bridge is made of wood. The suspension is made of steel that is not going to break. Or we even say 1,000 people have already crossed that bridge, so it's obviously safe. But if I'm scared of crossing that bridge, that's not good enough. How do we get people across that bridge? We have to talk about what's on the other side of the bridge or what's on our side that we need to get away from. Let me share something with you. In 1997, while I was in the Army, we had to get the anthrax vaccine. Those of you who know anything about it know that there were people who lost their commission, who were kicked out of the military because they refused to get that anthrax vaccine. But I needed to get it before going on a deployment. I decided that I needed to take that risk. Taking the risk, being brave, does not mean that you don't have fear. It doesn't mean that you're not scared or apprehensive or anxious. It means you do what you need to do despite being afraid. So I took that vaccine, I did my deployment, and I'm still here. The same can be said about the COVID-19 vaccine. There are people who are afraid of it. Anything new, anything unusual, that's a reason to be afraid. I told you I was afraid. I wasn't sure what my reaction was going to be with that second vaccine, but I knew it was on the other side of the bridge. I knew that once I'm immunized, I protect myself, I protect my family, I protect my patients. I help bring this to an end. So it was worth it. So what's the bottom line? When you're dealing with emotions, when we are trying to help earn your trust, we need to help you realize what's on the other side of the bridge. Another great example, the HPV vaccine. When it first came out, we as providers spent a lot of time talking about the virus and how this vaccine protects against the virus. It wasn't until we started talking about how it prevents cancer that we start getting more people to understand how important that vaccine was. Because we figured out the same thing that's important to you, protecting your children. We realized that you wanted to be on the other side away from cancer. So when we talk about HPV protecting you from cancer, we're able to get people to understand there's a reason to take that risk. There's a reason to go across that bridge. So with experience, with support, with building trust, we can help people go across the bridge. So another person who's on Twitter, Dr. Kimberly Manning, she has a fantastic Twitter feed called @GradyDoctor. And this week, she's spending time asking people their why they are getting the COVID vaccine and why they're a little afraid of it, why they're not getting it. That is exactly what we need to do as providers. We need to find out the why, what will get people across the bridge, not just for COVID, but our flu vaccination rates. We're lucky if half the people get a flu vaccine. We need to keep working on finding out that why. So to wrap it up, I want to give some practical advice for both providers and for people who are thinking about getting the vaccine. With these practical pieces of information, my hope is that you can take them with you, you can share them with other people, and as a provider, you can think about what you need to say and do to help people be more open to the idea of vaccines. So the next slide, we'll talk about practical advice for providers. The first piece of advice is to be non-judgmental when a family declines a vaccine. As an adolescent physician, I know about the tests that young people do. So I have to ask very personal questions. Sometimes they will give me a little bit of information just to test me. So I'll ask them things like smoking, about drinking, and they'll say, yeah, I've tried to vape once, and look for my response. If my body language says I'm judging them, if my body language says I disapprove, then they're not going to say much more. They won't share about other activity that they've done. Families with vaccines are the exact same way. When a family says they don't want a certain vaccine, they're looking at our face. They're looking at our body language. They're looking at, are we going to keep talking? Are we going to try to make them feel bad? So the very first thing we have to do is not be judgmental and listen for what they want, for their reasons. Second, it takes time. Every time I see a patient, I will offer the vaccines that they need, the ones that I trust. And they may say no the first time, but then I'll ask them again the second time, and then maybe the third and fourth. And as that relationship builds, as that trust builds, as they see that I want the same thing that they want, good health for them and their family, it's much more likely that they're willing to try it. The third one is listen for reasons that they have little trust. The Black community knows that the medical institution has been racist and discriminatory. That's a fact. So how do you get through that lack of trust? You have to admit what they're afraid of. You have to validate that what they've heard, what they've talked about is real. And the only way to do that is you have to listen and find out what they're really afraid of. And then last, if you're a provider and you know that this vaccine is important, you may have to double your efforts to show them that you believe their concerns. Again, if I'm speaking to someone who identifies with my culture, my language, it's a little bit easier. It's a shortcut. But someone who is very different from me, it's going to take more work for them to believe that I care about them and care about the same things that they care about. So that's for all the providers. Now, let's talk about as a patient, as someone who needs to receive a vaccine, what are the things that you can do? Just 3 things. The first one is be willing to share your concerns. If there's something that you're afraid of, worried about, that you've heard, that you've read about, if you don't tell us, there's no way that we can read your mind and figure out why you don't want to get it. Sometimes just admitting I'm scared of how I'm going to feel takes a lot of courage. Sometimes just saying I don't want to feel sick when I feel perfectly well takes a lot of courage. Say that so that we can have that discussion. And again, as a provider, if I lie to you and say no one ever feels sick, I lose your trust. So we have to be honest. We have to say some people do feel badly after getting the shot, but the end is worth it. The second thing for anyone who receives a vaccine can do is to be willing to admit that your family might not know as much about medicine as they think they do. I say it a little jokingly because there are people with nurses and doctors and other professional people in their family, but I'm not an infectious disease specialist. I'm not an immunologist. I know that there's limit to my knowledge. So be willing to say that even your family member who you trust and love and may have done all the research may be wrong. They may not have all the information, or they may have wrong information. If you're at least willing to consider that, we can definitely have a conversation. And then finally, keep asking questions until you feel reassured. There is no limit to how many questions you can ask when it comes to your health and you feeling like what we're talking about is important. Ask those questions. And to model how important it is to ask questions and have these conversations, that is going to be the final part of what we talk about. We are going to open it up so we can have conversation and I can answer your questions, not just about COVID, because I know that's on top of a lot of people's mind, but about all vaccine and what we can do to build trust on vaccines. So let's have that conversation. I do have help with Monica, who works here at People's Community Clinic too. And I see that there are some questions in the comments already. So I'm going to start going down the line. And if you have those questions, please bring them up. The first question is, I've heard some people have really bad reactions to the vaccine and others not so bad. Why is that? That's a fantastic question. And that is what caused a lot of hesitancy. We tend to listen and remember the bad things. When there's a shark attack, we're afraid to go to the beach because we think that shark is going to attack us. Does that mean that shark attacks don't exist? Absolutely not. So bad reactions do happen for some people. It looks like, according to the current data that's out there, the majority of people who have bad reactions are already sensitized to their immune system overreacting. So the people who need EpiPens, the people whose immune system is already hypersensitive, who respond to anything, either in their environment or an injection, beyond what the typical reaction is. Those are the people who seem to have the reaction. Just like here in Austin right now, the cedar was really high and some people react to cedar and other people have no reaction to it. Everyone's immune system is a little bit different. And that's why we have people who have bad reactions to vaccines and other people who do not, because our immune systems are different. That's a great question. The next question is it safe to be unmasked around someone who has had the vaccine? Can two people who have had the vaccine go unmasked? Another great question that's going to take more time to figure out. So the way the vaccine works is it tells your immune system to make antibodies against the COVID virus, right? So it doesn't prevent the virus from getting into your system. What it does, it lets your system attack the virus a lot sooner than if you've never, ever seen it before. Knowing that, and knowing that a lot of the virus goes into the nose and is transmitted by air and by droplets, someone who has been vaccinated can still have virus on them. What we need to find out over time is, will the antibodies that we create kill the virus quickly enough so that we won't be able to give a viral load that gets other people infected? And we don't know that yet. So the recommendation right now is that anybody needs to wear a mask, whether you've been vaccinated or not, whether you've had COVID or not. The safest thing right now is to assume that that virus is still everywhere and we still need to protect ourselves and protect each other from spreading this around. If it becomes like the flu and wintertime is the only time that it rears up, then we will know. For the rest of the year, we're okay, but we have to be more careful during the wintertime. So think of it right now as flu season. You do everything you can to prevent the spread until the word is given that the virus is almost non-existent. Great question. So the next question, how did this vaccine get developed so quickly? That's what scares a lot of people. You hear a lot of talk about other vaccines taking so long to develop, and this one was developed quickly. The only reason this one was able to be developed so quickly is because for the past couple of decades, people have been working on ways to create vaccines with new information. And that goes back to the military too. So as soon as the idea of a potential infectious bioweapon, anything that can be used against other people was thought about, there have been people researching how can we protect ourselves. And once China shared the actual DNA sequence, it was easy enough to use that sequence to plug it into vaccine candidates that already existed. So this wasn't starting from scratch. This wasn't people sitting around a room thinking, how can we do it? This was scientists already saying, if anything like the coronavirus or a similar virus is produced or becomes an issue, we're already a few steps ahead in the process to think, how can we protect people from it? So great question. This was done because people were already prepared. All right, the next question. What's the chance of having a severe anaphylaxis response to the vaccine? That's another percentage question that's going to take more time to figure out. We know that people who have had anaphylaxis to other things, and not just vaccines, but to food, that means that your immune system is more sensitive. If you've never had an allergic reaction to anything, your chances are very low. And I don't want to throw numbers because we're still learning. I would say that if you do not have any history of allergy or anaphylactic reaction, it's really, really safe. If you have had a reaction to something, that's something worth talking about. Does that mean we watch you closer? Does it mean we're ready with epinephrine or Benadryl or something to help go against the reaction? Those are things that we have to think about. So I can't give a generalized chance other than those who've had reactions in the past are more likely than those who've never had a reaction in the past. Great. Is the vaccine safe for mothers who are nursing? Is it safe for babies? Wonderful question. As a pediatrician and someone who works with kids, that's close to my heart. Is it safe for nursing mothers? So the way the vaccine works is it tells our immune system to create the antibodies against the vaccine. It is very safe for the people that it was tested in, but the problem is it was not tested in every single group. It's not been tested in anyone under 16. So the way the body works, the way biology works, is you can't predict every single iteration, every single thing that can happen until you try it and watch. So it's not safe for babies. Research will be done. We will figure it out. We know that even the flu vaccine, we don't give under 6 months because we don't test kids under 6 months. But as time goes by, we'll get more information and we'll be able to say whether it's safe. Now, there have been nursing mothers who've gotten the vaccine, and we're relying on them, especially the healthcare workers who are both pregnant and nursing, and we're going to see how they respond. It's an ongoing process to keep an eye out for any bad reactions. So we keep looking for any side effects for anyone who gets the vaccine. Great. Next question. How soon can a person who's healthy and young and younger than 65 get a vaccine? Great. So you're seeing now that the CDC just recommended that everyone go to 1B, to people over 65 and people with pre-existing conditions. The idea is the sooner you vaccinate the people who are most at risk, then you can move on to the people who are at a lower risk. We see how slow the vaccine is being rolled out. We are only about a third of the way of the distance of what we expect it to be. So the prediction of how soon will we get to where we should be it's hard to tell. I wish I could give you a real estimate, but whatever I give you, I do not have the clearance. I do not have the inside information to tell you when that will happen. But I will say that for most of the organizations that are giving the vaccines, they are working very hard to be able to give it to the groups that have been authorized and make sure not a single dose is wasted. So you hear stories about people waiting for Target to close or other places to close because we do not want a single vaccine to get wasted. But when will it happen where it's open to the general public? It will probably, in my estimation, be near the summertime. Next question. Should we be concerned about which vaccine we get, Pfizer or Moderna? Absolutely not. 95% versus 94% is essentially the same. There's a time difference between the two, between the first and second, between the Pfizer is 3 weeks, Moderna is 4 weeks. So if you are in a situation of higher risk, maybe you want to do the Pfizer so you can get your immunization completed sooner. But the advice you hear over and over again is whichever one you can get, that's the one you should get. After getting the vaccine, how soon will I be protected from getting COVID? Another wonderful question. Even after the first dose, we are starting to train your body to fight the virus. We're training our body to make some of the antibodies to protect us. The research has been done with the timetable that's been given for each one. 3 weeks for the Pfizer and 4 weeks for the Moderna. And then they were tested. And that's when the full effectiveness was seen. Usually about 2 weeks after getting the second dose, most of the people in the study had the full immunization, were producing enough antibodies to be protected. So a general rule of thumb, we think about 2 weeks after getting your second dose. If you have had COVID, do you still need the vaccine? The recommendation is still yes, because we don't know how long natural immunity is going to last. We don't know how long people will be able to be protected even if they've had COVID. And we know that your immune system is even more sensitized with the vaccine. So it probably offers you better protection than actually having had the virus. Can you get the vaccine when you're COVID positive? That's a fantastic question. So you are contagious for 10 days after getting COVID. So we want you to isolate. So please, 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 if you think you have COVID, if you think you've recently been infected, do not get into a line. Do not go to a crowd to try and get vaccinated. You are potentially exposing everyone else in the line to COVID, and that is not what we want you to do. So general rule of thumb, do not get the vaccine if you're COVID positive. Wait until you've done your quarantine and you are no longer contagious until you get the vaccine for COVID-19. I will be getting part 1 of the vaccine tomorrow. How am I assured that the second part will be available when I need to get it? There are no assurances in life. I wish I could say that every single organization has made preparations so that anyone who gets the first dose will automatically get the second. We've all heard the news that more of the vaccine will be released, and the reserves that were being held back are no longer going to be held back. So don't panic, because we also know that even if you don't get it at the exact time, getting the second dose anytime after that will still give you protection. So you may not have it on the exact 21st or 28th day, depending on which vaccine you get, but you are in line and you will be eligible and you will be able to get it and get your full protection. And you get some protection from the first vaccine. Should I pre-treat, take Tylenol to help with side effects from the vaccine? All the research that was done were done with people who did not pre-treat. So the 94 and 95% effectiveness are based on people not taking any other medication. So the recommendation not to pre-treat comes from that. We don't know if that will affect the effectiveness of getting the vaccine. So our recommendation is get your vaccine. If you do get side effects, then go ahead and take something, but try not to pre-treat. Okay. I think that we have hit the last question. It has been my privilege. It's been wonderful to talk to you all, to share my knowledge. It was all about COVID, but there are other vaccines that are just as important. The American Academy of Pediatrics is emphasizing very strongly that parents should not forget all the other immunizations that kids need. And we realize that a lot of times people get immunizations because it's mandatory. You can't go to school without it. But there are other vaccines, the other immunizations that people need because they know the other side of the bridge is so important that they would do it whether they were told to do it or not. So please think of COVID-19, think of the other vaccines as the vaccine that you need to stay healthy. Talk to your provider, ask the questions, and know that we're here because we want the exact same thing that you want. We want you to be healthy. Thank you all. Be well, and talk to you soon.